today we are going to learn about a very important drug molecule which is used in the management of high blood pressure, that is hypertension. And the name of that molecule is Telmisartan. Now let's try to understand what is Telmisartan and what it is used for. Telmisartan is belonging to a group of medicines called as angiotensin 2 receptor antagonists. There are various other molecules which come in this category, like olmesartan, valsartan, etc., etc. Their mechanism of action, their side effect profile, their precautions, warnings, all are more or less the same. But telmisartan is an important molecule so far as the Indian population is concerned, because it is maximally prescribed by the local physicians and cardiologists. So let's try to understand more about telmisartan. So as I've said, it belongs to the category of angiotensin 2 receptor antagonist. Now, what is angiotensin 2? Angiotensin 2 is a substance which is produced in our body, which causes the blood vessels to narrow. So if the blood vessels are narrowed, naturally there is a resistance to the onward progression of the blood circulation, and this increases the blood pressure. Telmisartan blocks the effect of angiotensin 2 so that the blood vessels relax. So once the blood vessels relax, the blood can easily flow through, and therefore the high blood pressure is lowered. Telmisartan tablets are used primarily to treat essential or primary hypertension, that is high blood pressure in adults. Essential means that the high blood pressure is not caused by any disturbance in the structure or function of the major organs. This is the commonest form of high blood pressure. Telmisartan is also used to reduce the cardiovascular events, that is heart attack, or also the cerebrovascular events, that is stroke, in adults who are at risk because they have a reduced or blocked blood supply to the heart or legs, or have had a stroke, or have a high risk of diabetes. Of course, when you go to your doctor will tell you whether you are at high risk of having such events or not. What do you need to know before you take telmisartan? Please do not take telmisartan if you are allergic to telmisartan or any other ingredients of the medicine or of the tablet. Or if you have severe liver problems, such as it is called as cholestasis or biliary obstruction. Now, what happens here is there is a problem in the drainage of the bile, which is produced in the liver, which goes to the gallbladder. So there is an obstruction to the drainage of bile to the liver, and from the liver and the gallbladder. Or if you are having any other severe liver disease, if you have diabetes or impaired kidney function, or if you are treated with a blood pressure lowering medicine containing a drug called aliskiren. So if all of this or any of this applies to you, then please tell your doctor before taking telmisartan. Now, what are the warnings and precautions which one has to take before taking telmisartan? As I've said, that please talk to your doctor if you have suffered in the past, or if you are suffering from the certain conditions which now I'm going to name. One is kidney disease, or suppose you have undergone kidney transplant. Then there's a condition called renal artery stenosis. Now, what is renal artery stenosis is there's a narrowing of the blood vessels, of the arterial blood vessels, which are supplying blood to one or both kidneys. Then if you're having liver disease or some heart trouble, then there's a hormone called aldosterone. So if the level of aldosterone is raised, even then you have to tell your doctor. Now, what are the telltale features of raised aldosterone levels? Is that there is water and salt retention in the body. In addition to that, there may be some electrolyte imbalance as well. Then if you are having low blood pressure, it's likely to occur if you are dehydrated. That is, there is excessive loss of body water. Or if you have salt deficiency due to, say, suppose you are taking some diuretics, which increase the urinary excretion, or if you're having a low salt diet, if you're having diarrhea or vomiting, all these conditions lead to low blood pressure, and therefore one needs to inform the doctor accordingly. Or if you are having elevated potassium levels in the blood, diabetes I've already told you. Talk to your doctor before taking telmisartan. If you are taking digoxin, which is a medication which is used for certain heart conditions, or if you're taking any of the drugs which I am now going to enumerate, which are used to manage or in the management of high blood pressure. One is ACE inhibitors. That group is called as ACE inhibitors, and all the prils come under ACE inhibitors, for example, enalapril, lisinopril, ramipril, etc. And in particular, if you are having diabetes and kidney problems. And aliskiren, of course, I've already told you. Your doctor may check your kidney function, your blood pressure, and certain electrolytes, that is especially sodium and potassium and chloride, before starting this drug, that is telmisartan. Now, what are the other important medications or drugs which you need to keep in mind when you are taking telmisartan? Tell your doctor if you are taking this, or if you have recently taken, or might if you have been taking with other medicines. Your doctor may need to change the dose of the other medicines or take certain precautions. And in certain cases, sometimes you have to stop taking one of the medicines. So which are these medications? One is lithium, which is used in the management of depression. Then medicines which may increase sodium or rather potassium levels, that is salt substitutes which contain potassium, then potassium sparing diuretics, which retain potassium and yet increase the urinary excretion. ACE inhibitors I've already told you, like enalapril. Then certain other angiotensin 2 receptor antagonists, if you are already taking. Then also NSAIDs, that is non-steroidal anti-inflammatory drugs, for example, aspirin or ibuprofen. Then heparin, which is a drug which is used to thin the blood. Then certain immunosuppressants like cyclosporin or tacrolimus, which are used in the management of, say, cancers or certain hyperimmune diseases. Then the antibiotic trimethoprim, digoxin, I already mentioned. Now, the effect of telmisartan may be reduced when you take these NSAIDs or even corticosteroids. Telmisartan may increase the blood pressure lowering effect of other medicines used to treat high blood pressure, or of medicines with BP lowering potential. Certain drugs are there like baclofen, etc. Now, one also has to remember that low blood pressure can be aggravated by consumption of alcohol, barbiturates, which are certain sedative drugs, narcotics, or antidepressants. You may also notice this as dizziness when you suddenly stand up, and that is called as postural hypotension. So you should therefore consult your doctor if you need to adjust the dose of other medicines, which I have already mentioned, if you are taking telmisartan. What about driving and using machines? Well, certain people feel dizzy or tired when they take telmisartan, and therefore, if you feel dizzy or tired, please do not drive any vehicle, or please do not operate any machines. Does telmisartan contain sodium? Yes, it does contain sodium, but please be assured that this sodium is very, very less. That is hardly 1 micromolecule. It comes to about 23 milligrams per tablet, and which practically means that telmisartan is sodium free. Now, how to take telmisartan? Please always use telmisartan exactly as your doctor has prescribed. Check with your doctor and perhaps with your chemist or pharmacist also if you're not sure. For the treatment of blood pressure, high blood pressure, which I mean, the usual dose of telmisartan for most patients is 140 milligram tablet once a day. 140 milligram tablet once a day. The doctor may recommend lower doses of maybe 20 milligram once a day in certain patients. Telmisartan is often used in combination with certain other uh, high blood pressure medications, for example, diuretics or amlodipine or metoprolol, and they have an additive blood pressure lowering effect. So one needs to adjust the dose of both very carefully. Also, for the reduction of cardiovascular or cerebrovascular incidents or events, that is myocardial infarction, that is heart attack, and stroke, paralysis. In these conditions, the dose of telmisartan is slightly higher. That is, it is 80 milligrams given once a day. At the beginning of this therapy, that is telmisartan 80 milligram, blood pressure should be frequently monitored because otherwise your blood pressure may suddenly go down. In patients with liver problems, the usual dose should not exceed 40 milligrams once daily. So therefore, the doctors may reduce the dose to maybe 20 milligrams once daily. In patients with kidney problems also, a lower starting dose of 20 milligrams once daily is recommended. So elderly people, senior citizens who are having these problems, please remember that telmisartan can be or should be given in a reduced dose, that is 20 milligrams once daily, which your doctor will tell you. And try to take the tablet at the same time each day. Now, what happens if you forget to take telmisartan? Very common. So if you forget to take telmisartan, please take the dose as soon as you remember. But what is more important is on the same day. If you do not take your tablet on one day, then in case you forget for all the 24 hours, then take your normal dose the next day. But please do not double the dose the next day, replacing it for a forgotten dose. If you stop taking telmisartan, that's an important question. So please, as I've said, please take telmisartan as long as your doctor prescribes it so that your blood pressure remains controlled. If you feel that the effect of telmisartan is too strong or too weak, then talk to your doctor. So accordingly, you may be able to adjust the dose as per his advice. And if you have any further questions on the use of telmisartan, definitely you should talk to your doctor. Should telmisartan be taken on empty stomach or with food? You can take telmisartan with or without food. These tablets should be swallowed with some water or any other non-alcoholic drink. What happens if you take more number of telmisartan tablets accidentally? Remember, if this happens, please contact your doctor or the nearest hospital or nursing home where they have a casualty department to take care of this emergency. What are the common symptoms or features of telmisartan overdose? They are generally low blood pressure or fast heartbeat. At the same time, slow heartbeat or dizziness or higher levels of creatinine in blood. Of course, that is after the blood is checked. And sudden kidney failure can also be possible. So please remember all these things when you are going to unnecessarily or accidentally take more number of tablets of telmisartan.